Here are today's learning objectives. 1. Identify some common risk factors that can lead to gluteal tendinopathy. 2. List 3 tests to differentiate trochanteric bursitis and gluteal tendinopathy. 3. Discuss the best evidence-based treatment option for someone experiencing gluteal tendinopathy.
Ladies and gentlemen, please put your hands together for Dr. Paige.
Hi everyone, I'm your host, Dr. Paige. On today's show, we will be discussing gluteal tendinopathy. Gluteal tendinopathy is the most common hip tendon injury in postmenopausal women. It most commonly occurs in the gluteus medius muscle. Apparently our producers have decided to be a little cheeky this evening. Let's cut that off for our audience, please. There we go. Carrying on, gluteal tendinopathy usually comes about from an accumulation of compressive tendon loading due to excessive hip adduction, both during static postures and dynamic tasks. It is often misdiagnosed for trochanteric bursitis. We have 2 guests today. One of these participants has gluteal tendinopathy and the other trochanteric bursitis. We will be finding out who has what in today's episode.
Meet today's first candidate, Martha May. She is 55 years old and works prolonged hours at a desk job. Please observe the way Martha sits with her hips abducted and the way she stands with her hip popped out to the side. One of Martha's legs is also significantly shorter than the other. Martha has also recently started training for a 10-kilometer run, something she has not done for quite some time. Our second candidate is Iris Iverson. She is 40 years old and is currently experiencing lateral hip pain. As you can see, Iris is in quite a lot of pain, and she is limping when she walks. If you look closely, you can see some swelling on the lateral aspect of her hip. Though all these facts may seem random, they will help us determine which of our 2 guests has gluteal tendinopathy.
Now that we have met our guests and established the risk factors for gluteal tendinopathy, I would like to introduce you to our resident physiotherapist, Ivana Carrie.
Thank you for having me on your show today, Dr. Paige. It's such a pleasure. I'll be doing 3 tests to determine which of our guests has gluteal tendinopathy. I've informed them beforehand to let me know if they're experiencing any pain. So let's move ahead to the test. So the first test we'll be doing is the 30-second single leg stand test. Our guests will be standing on their affected leg for 30 seconds, and I'll be close by if they need any support. Alright, so the second test we'll be doing is a palpation test. I'll be palpating over the greater trochanter of both of our guests. The final test we will be conducting is the Faber test. This consists of hip flexion, abduction, and external rotation. I'll move our patient Iris through the test passively. Through this test, I'll be adding some resistance, and this will create tension and compression on the affected tendon. Those who are positive for gluteal tendinopathy should experience some discomfort. Again, it's hip flexion, abduction, and external rotation. Once again creating the 4, and I suspect there's going to be pain when we add the resistance. And Iris is doing well for the test.
And now, a word from our sponsors.
Hey, have you heard? There's a new gym opening up in town in 2 days at the corner of Broadway and Origin. With 2,000 square foot floor space, 24-hour service, and state-of-the-art equipment, you've got no excuse to not get in shape. Head pain got you down? We'll throw in a free 10-session coupon with one of our kinesiologists. Strengthen your abductors with low-load isometric contractions. You'll be back to normal in no time.
I work out.
Brr, it is cold outside, but the cold serves an important tool. Are you experiencing gluteal tendinopathy? Then ice is the way to go. Ice is nice, constricting vessels, reducing inflammation, and thereby decreasing pain. Use ice for your gluteal tendinopathy issues.
back, ladies and gentlemen. Before the break, we were trying to find out which of our two guests, Martha and Iris, had gluteal tendinopathy. After many tests and a secret MRI exam, we have determined that Martha May has gluteal tendinopathy. If you will please exit the stage to our right, Ivana Curiou will be conducting some tests later. So ladies and gentlemen, if you look up to my screen here, you will be able to see the MRIs of both Iris and Martha.
Iris's hip shows a bulge on the lateral side, or the inflamed bursa sac. Martha's image shows a darker area. This darker area shows a tear in the gluteus medius tendon, characterized by its discontinuity of the tendon at its insertion onto the greater trochanter. Now that we've determined that Martha has gluteal tendinopathy, what are her options for treatment? Ivana, take it away.
Well, Dr. Paz, the best way to treat gluteal tendinopathy is conservatively, with physiotherapy and strength-based exercises. Here, we'll have Martha demonstrate a few for us. Personally, I'd recommend sustained isometric muscle contractions because they have been shown to have analgesic effects. For instance, here, we can use low-load isometric abduction while supine for Martha. So Martha, can you move your legs away from the band? Resistance. A few times for us. Once again. Fantastic. Alright, so now we'll be doing a similar exercise with Martha lying on the side that doesn't hurt. So Martha, I'm going to ask you to move your uppermost leg upwards. And we are using gravity as a resistance in this case. Excellent. Nice work, Martha. So, Martha, aside from strengthening exercises, there are a couple of evidence-based treatment options that physiotherapists would recommend, such as shockwave therapy.
What's that?
Well, shockwave therapy is used to penetrate deep into the muscles, and they provide pain relief for healing. It's sometimes not initially suggested, and we call it a second-line therapy. Unfortunately, conservative therapies don't always work, and especially for more complicated cases. So when all else fails, surgical intervention for gluteal tendinopathy can be considered. However, surgery isn't without its risks, and it should be undertaken with awareness from your doctor.
And now, a word from our sponsors.
Do you have pain from damaged muscles and tissues? Shockwave therapy has been proven to be effective in patients with lateral hip pain or gluteal tendinopathy. The waves stimulate and enhance blood circulation so damaged tissue can gradually heal. Our radial shockwave 4000 can penetrate soft tissues up to 40 millimeters, so you'll be sure to feel good at least for a year. It's electrifying. Have you tried ice packs, heat pads, exercise routines, even shockwave therapy, and nothing seems to be helping with your hip pain? You may have torn your tendon and not even realized it. Surgery might be the best thing for you in this case, my friend. Let me help you with that. 90% of patients said they're walking with no pain a year after surgery, and 78% of them say they're walking like new again. Give us a call at 1-800-555-6666 for a free consult today. Always ask your doctor first.
Side effects may include pain immediately after the surgery, nausea or constipation from the anesthesia, hematoma, fever, signs of shock, pulmonary embolism, rash, long recovery time, possible complications, infection, and maybe even death. Now it's time for my favorite segment of the show. Don't pause, answer the question. I want all audience members to take out their phone, please, and call this number now, 604-880-6274. I will answer caller number 3, and they will be asked some questions. If you get the answer right, you will win tickets to my next show. Thank you. Hi, thank you for calling. So I have 4 questions for you to answer, and if you get them all right, you'll get tickets to my next show. The first question is, who is more commonly predisposed to gluteal tendinopathy, males or females?
Females.
That's correct. What test should be conducted in order to confirm gluteal tendinopathy diagnosis?
MRI, clinical test, palpation over the greater trochanter, and Faber.
Wow, good job. That's correct. Where does pain occur for individuals experiencing symptoms of gluteal tendinopathy?
Over the greater trochanter. It can also radiate down the leg.
That is also correct. Last question. What are the main objectives of a following physiotherapy treatment for gluteal tendinopathy?
Unload and strengthen.
Those are all correct. You've now won tickets to the next Dr. Paz show.
Woo! Thank you.
Thank you, and that's all the time we have today. Take care.